I see a lot of handsome people out there. I don't know if that's the politically correct word of the day or not. Probably not.
Okay. I have 1:30 or 2:30, I'm sorry. So we're going to go ahead and start.
Are we live? Are we live on YouTube?
We should be live on YouTube also. Melinda, do you see us out there? Okay, so just a minute and we'll see. It should go out there real quick. I think we're ready on YouTube Live also.
Okay. Do you want me to start with a situation update, Tracy?
If you want to, that's fine. That would be awesome. I want to say thank you all. Before we do that, I want to say thank you all for joining today. I'm going to turn it over to you, Sean.
All right. And we broadcast this simultaneously on YouTube Live so that we give the chance for the community to stay just as up to date as we can. This is a very rapidly changing situation, and every day throws us new curveballs, and there's new layers of this onion to peel back and to try to work through. Right now, the members of my medical leadership and my environmental leader and my planning leader are all tied up in a conference call dealing with an important issue, and they may be joining us in a few minutes. It may just be me. If I'm the only one giving you information, I'm pretty good at giving general information, but of course, my medical staff and environmental staff could dig a lot or dive a lot deeper into some of these questions than maybe I can, but we'll see. Looks like I see Stuart popping in, so maybe they've finished up their call and we'll be able to join us. Yep, there's Laura. So they'll get their audio stuff taken care of. One thing I will begin with, I posted a request on our website and our social media page saying to the citizens of Lake Cumberland that our district continues to be in need of personal protective equipment. And if anyone out there happens to have any surgical gowns, medical face shields, surgical masks, N95 masks, the health department is collecting those items if you have something to donate. And we put them and we don't have a lot of that material, but what we get, we secure it up here at our district office. And then we divvy it out to the medical providers, nursing homes, EMS, police, whoever needs it as they request it as best we can. And again, there's not a whole lot of it, so we're not able to feel confident we've got enough to handle the situation. So any that we could get donated would be great. We also put a request out. There are places that's delivering meals like schools and Meals on Wheels. There's food banks and drug treatment centers, and there's other places in the community that could benefit from receiving some homemade masks. On our post, we included a link to the Centers for Disease Control website that describes how to make an effective mask. And if there's any skilled folks out there in the community that can make those and want to make those, there's people that could use them. So that information is on our website. If you have materials to donate, or if you want to make masks and help get it to some of those places that could use it, we would appreciate that. So maybe some of you guys out in the media can share that information for us and help us out. What's our status right now? In Kentucky, as of when the governor made his announcements last night, there was 1,149 confirmed cases in the state. What we don't know is, at least at the state level, is we don't know how many of those cases are now released from isolation. Those are cumulative confirmed cases. Certainly some have come off isolation, so those are not all currently active cases. But as far as cumulative confirmed cases, 1,149. There's been 65 deaths in the state as of last night when the governor made his report, causing or resulting in a 5.66% mortality rate for the state. In Lake Cumberland, as of last night, we had 53 confirmed cases when we updated our website. This morning, I think we've already received 6 new confirmed lab reports from the labs that came in late last night and early this morning, and we may get some more when the morning labs run and the reports, the results come in this afternoon, this evening. So we'll just have to see how it goes, but we always update that information sometime in the evening on our website so everyone will know where we're at, where the cases are, which counties, and so forth. We have had 2 deaths in our district right now. That puts our mortality rate at 3.77. We have had 16 as of last night of our 53 cumulative confirmed cases to be what we might consider recovered or released from isolation. When someone's released from isolation, that just means they've been symptom free for a long enough period of time. They're no longer considered a health risk and they're free to go about their life. I think that's one of the questions that will be answered more precisely by my medical staff later. I looked just a few minutes ago before we got on the website, and all of this information is available either on our website or on links from our website. So if you're not using our COVID-19 page and the links off that page, you can get this information from there because that's where I just got it from. In the United States, as of the moment I checked this about an hour ago, the United States is on day 28 of since its first confirmed case. Currently, the 7-day average growth rate is 1.14, or it means it's growing by cumulative confirmed cases is growing by about 14%, which translates into it's doubling. The total number of cumulative confirmed cases is doubling about every 5.29 days, which is better than it was last week when it was growing, doubling by about every 3 days. So it looks like maybe the United States is starting to flatten a little bit. We certainly hope so. Today, well, that was on day 28. The United States is presently on day 31. I'll come back to that day 28 thing in a minute. I confused myself on the way I have my notes written. The United States is currently on day 31 since its first confirmed case in the United States is at a 1.11 growth rate or 11% per day, which is doubling at 6.64 every 6.64 days. Now, why did I bring up the day 28? Because Kentucky right now is on day 28 since its first case. So if we want to really compare apples to apples to the US average, we have to look at the US rate on day 28 because they're a few days ahead of us since their first case. So on day 28, the United States was at 1.14 growth rate, and at Kentucky on day 28, we're at 1.09 growth rate, which for the United States on day 28, the cumulative confirmed cases was growing or doubling every 5.29 days. And in our district or in our state as of today, it's growing at doubling about every 8 days. And those projections change every day depending on how many cases come in. So, that's just where it is today. Maybe that's a sign things are starting to level out. Maybe we'll have 2 or 3 really bad days and it won't look so positive in a day or two. We'll just have to let time tell. On our website, on our coronavirus 19 website, if you look at the number of confirmed cases per 10,000 by week on the trend chart at the bottom of the page, and you kind of have to look at the Kentucky compared to the district average. If you look at any single county, we have the single county information out there, but our population size is so small in some of those counties that it's really not a good sample size. One case in Cumberland County, for example, they have such a small population would proportionally make them look far worse than the state average. So I tend to go by the district average. our district average on new confirmed cases, cumulative confirmed cases per 10,000, we're really running our trend is running almost a mirror image of what the state trend is running. So that's good news in the sense that if you look at the world data, the United States is as a whole, we're pretty deep into this as a country, and it looks like it's starting to level at a national level. And then when you look at the various states in the nation, Kentucky is doing far better than most states in the nation, and I contribute that to the aggressive actions that the governor took and the aggressive actions that public health has taken in the local health department, and all of our community partners, and the sacrifices that all of our citizens have been making. So we're glad to see Kentucky's total numbers per capita being lower than national averages, and one of the better states in the nation. And from that point of view, it's good that Lake Cumberland is running along with the state average, because the state average is really doing pretty good at the national average. Now, it may not feel like 28 days into this that we're doing really good, because it's a lot of work and a lot of new situations come up each day. But it is good to know that compared to others, we've responded pretty aggressively, and it looks like the results of that are very positive. The most complicated things that we're dealing with right now in our district is as these confirmed cases make their way into our long-term care facilities, it really complicates things. I will say that I've saw on social media a lot of frustration about us not announcing what businesses that confirmed cases are in, as far as employees that have worked there. What I will say to that is, we consider this disease to be widespread. That means if you're in a business with several people, somebody inside there probably has it. So you should always observe social distancing, even if you're at one of these what we call non-public facing businesses. If you're allowed to be open, just because you're at work and allowed to be at work doesn't mean that you're allowed that doesn't excuse you from the social distancing, the 6 feet, not taking breaks together where you're right beside each other. If you carpool to work, probably not a good time to be carpooling, and those kinds of things. You should still be taking all the precautions, because somebody in your facility probably has it. And if you want to avoid everyone in the building getting it, everyone should be observing that 6 feet social distancing, washing their hands regularly, not touching their faces. So the nursing homes are a much greater concern because of the extreme number of high-risk individuals that are in those nursing homes. They wouldn't be in a nursing home if they didn't have considerable health conditions already, and if many of them are elderly. So I have had several people ask me, how did this get into our nursing homes since they're on lockdown? Well, there are a limited number of people who's allowed to go in and out of the nursing home. The staff, for example, go in and out, and there are limited amounts of necessary medical services that have to happen where people come in and out. Even since a number of people who have the COVID-19 disease, since a number of them are asymptomatic, or their symptoms are extremely mild, they could have brought this in and had no idea that they had the virus. And even though they didn't feel sick, they were still symptomatic. Even though they weren't symptomatic, they were still contagious, and were maybe able to spread it that way. But I can't say for sure how it got into the nursing homes. I'm just speculating that's one way it could have, because certainly whether it's a church, or whether it's a factory, or whether it's a nursing home, people come in there, they may not feel sick, they may have it, they may still be contagious. So it's really important that all the precautions possible are being taken in every instance. As far as the nursing home goes, the the nursing home in Adair County has been hardest hit, and you know, they are, and we are trying to help them take aggressive actions to mitigate the circumstances there. It's a difficult situation when it gets into a nursing home. So, you know, we've also reached out to all the nursing homes and long-term care facilities in our district to make sure that they not only have really good prevention plans about what they're doing to try to keep it out, what are they going to do if it gets in? How are they going to respond? What's going to be their first and quick actions? And we've been making sure we've been giving clear and additional guidance to the long-term care facilities. So that's what I have as far as updates. Tracy, is there anything I've missed that you felt like I should have covered?
No, I think you've done a good job, Sean.
All
Thank
right,
you for
so
that update.
I think our operations staff are now online, so you can ask them the questions that were submitted, and we'll maybe take questions by county.
Yes, and also what I'll say too, as we go through this, for anyone out there, there's a chat box. So the chat box is at the bottom of the menu for Zoom. If you have a question, type it in the chat box and we can answer those also at the end. So we're going to start with Laura and or Dr. Wayman. Are we going to be able to get more tests for the public, or are tests being done only when a person goes into the hospital?
Testing capacity across the state is increasing. Some private providers, as well as most hospitals, do have the capability to provide tests now. An individual doesn't have to be in the hospital to be tested. So we suggest folks that feel like they need to be tested or would like to inquire about testing to call their healthcare provider first, and then a determination will be made whether they'll be tested or not.
Okay, thank you. I've got a couple of questions for you, Laura, that I'm going to walk through, okay?
Okay.
What is the process for a reported case of COVID-19?
The healthcare facilities, when they receive positive results, they are required by a KAR 2020 to report those to local health departments.
Laura, can you go ahead and walk us through what you do when you get a confirmed case, just the whole process, how we handle it?
Yes. Well, I'm going to talk about the difference between a case and a contact, which I think will cover that. And if there's questions related to that, then I'll address those. A case is someone that's been tested and received a positive result of a COVID-19 test. The case is then instructed by the health department to stay home and self-isolate themselves as we instruct them. If it's possible, they are to avoid close contact with a person living in the home with them by relocating to a separate part of the home. That's what we prefer, although we understand that's maybe not always possible in some cases. Once we've identified a case, we call that person every day and check on their status until we have determined that they may be released from self-isolation. As we contact the case, we gather their contacts, and how we do that is we talk to them about their symptom onset, and we go back 2 days prior to the case's symptom onset of symptoms, and we get the information on contacts. A contact is defined as someone who the person that tested positive has been in close contact with for more than 30 minutes. Once the contacts are identified, they're contacted by us at the local health department. If they're found to be asymptomatic, they're instructed to stay home, self-quarantine, and monitor their health symptoms for 14 days. If they're symptomatic, they're instructed to self-quarantine for 14 days and also contact their healthcare providers for further guidance.
Okay, thank you, Laura. But I've got a couple more, so either you or Dr. Wayman can help me here also. What does it mean if a case is released?
A case is released when they are in recovery or recovered, and this is defined as no fever for at least 72 hours, improving symptoms, and at least 7 days have elapsed since the date of onset of symptoms. That is when they can be released from isolation and considered non-infectious.
Okay, thank you. Are positive tests tracked by the county of residence or where the test was given? And also, is it possible a positive test listed for one county may be someone living in another county?
Tests are reported by the county of residence.
We can't hear you, Dr. Wayman.
Sorry. Tests are reported by the county of residence of the actual person being tested. Now, the other question was,
Is it possible a positive test listed for one county may be someone living in another county?
I can kind of answer that. Yeah, this, I know during the governor's report that he makes corrections from time to time. And if you look closely at the data they post, there's corrections made each day. There are times when someone will be accidentally listed at the county where the person tested, but that's corrected when the state reconciles the data. I know at the state level, they have, up to 50, 75 cases that they know is positive, but with unconfirmed locations, which means that can mean a couple of things. It just means they may have not drilled down to that level yet, or it may mean that they received information from a lab and they may have received the report on the same individual from a doctor's office, and they may have even received the report on that individual from the health department also. So they may have 3 different reports of one case. So they have to reconcile that data, and sometimes it takes them a day or 2 before they're able to finalize or confirm the case, that even though they report it as confirmed, the final location sometimes is a day or 2 later as they reconcile all that data. For us, if you look at the Air Lake Cumberland District Health Department website, when we post the information, that's what we know locally. We're the first ones that get notified of the confirmed case. So our information for our 10 county district is the most current and accurate information for our 10 counties that you're going to find. The governor's information may be 1, 2, or 3 days behind for our district. So if you want information about us, look at our resources.
Okay, thank you all. One more question, and this is for Dr. Wayman or Laura also, as I'm walking through. Is the district anticipating receiving any of the new fast test kits? And you may want to explain those fast test kits just a little bit too, Dr. Wayman.
Laura, the camera's pointed at you, but you're not talking.
Okay, I'm sorry.
Grab the microphone.
Okay, all right. Eventually, we hope they'll have, we'll have some available. We don't have a timeline for that.
So this next question, Sean, I'm going to direct it towards you. Can you provide demographic information regarding the current cases in the Lake Cumberland district? And I think they're wanting to know if you can tell county specific and their age and gender and some demographics.
I could, yes. We give district-wide demographic statistics on our website. The reason we withhold some demographics locally is trying to preserve patient confidentiality. In small counties with only one case, if we list the gender and the age, it really narrows down the options for who that might be, and it really, in these small towns, it's difficult to protect patients' information anyway. So, our effort to try to protect the patient's confidentiality as best we can, we only report that data at the district level.
Okay, thank you. Dr. Wayman, could you explain the recommendation for using cloth mask at this time? And also, do the paper mask like people use for mowing lawns, work at all?
Are somewhat like surgical masks. That is, they prevent the spray of somebody which produces respiratory droplets, which can be infectious, from hitting your nose and mouth.
When you say spray, is that someone coughing and sneezing or someone breathing?
So I have one right here. It's like the old-fashioned surgical masks before we had ready-made ones that we throw away. Since we are short of surgical masks anyway, a lot of people are making their own. You want it to be thick enough to stop the droplets, but not that bad that you can't breathe through them. If you put one on, you need to always realize which is the inside of the mask and which is the outside, so that you always put them on the same way. At the end of the day, when you stop using them and you want to wash them, just like you would wash anything else in the washing machine with warm water and dry in a dryer, you want to, after you take it off and put it in the washing machine, you want to wash your hands. What else? Most people only need a surgical mask. This is a droplet disease, not an airborne disease. However, it is not recommended for hospital use in the situations when you aerosolize particles, such as suctioning patients or intubating patients, or even using nebulizers for asthmatic patients.
Dr. Wayman?
I think that covers it.
Dr. Wayman, can you hear me?
Oh, well, the other question was, could you use the masks that you buy at Lowe's for mowing? Yes, you could. It's a physical barrier and it works just as well.
Dr. Wayman? Do you hear me, Dr. Wayman?
Can't hear you, Sean.
You can or can't?
Still can't hear you.
Do you hear me, Tracy?
Well,
I do
not.
hear you.
Okay, sorry.
Can you relay this to Dr. Wayman? When what she's saying, I think, is that the only time you need N95 is for certain surgical procedures where the I guess the contents of the lungs would be aerosolized. For most instances, the surgical mask or cloth mask, since it's the larger droplets, is sufficient. Can you relay that?
Well done, Sean.
She
Is that
heard you,
correct?
Sean.
That's
Is that
correct.
correct?
Okay.
Yes, you are correct. This question is going to be for you, Stuart, and maybe Laura also. What's the protocol for non-compliant COVID-19 cases?
Okay, so hang on one second. If we have a suspected case of COVID that's been reported and they're not isolated, then what's going to happen is this: we're going to receive that complaint into the health department. The environmentalist is going to take that complaint. Now, the complaints we receive, we would really prefer to have a phone call into the health department if it's important enough that we're seeing people out there and that we're going to complain on them and we feel like it's the person, then really we don't want it through Facebook. I mean, we don't want it through necessarily lines of just social media gossip. We want those complaints to come into the health department by a phone call. And once we have those, then we're going to ask for the name of that person, because we need to verify who that is. We'll then, the environmentalists, we don't have the names of the people. So in that case, we will forward that name on to the nursing division that's investigating these complaints. We're even, we even think it's important to keep HIPAA compliant in the health department. So not even environmental has the names of these cases unless we need that name to do some type of enforcement. Once we verify that is an actual case that has broken self-isolation, then we would forward that on to the county attorney and to law enforcement so we could secure a court order for that person to isolate, and we would sign that warrant for the courts to issue that order. Either us as the enforcement, or if we're not available, then the chief nurse in the county could sign that.
Tracy, can you mute Laura's mic while Stuart's talking so to avoid the echo?
I'm sorry. Yes, I just done that.
If you want to make me co-host, I can help you monitor that.
Okay. All right. So Stuart, just to summarize, if there's a protocol, what the protocol is for non-compliant COVID-19, you're going to receive the complaint through the health department, the environmental division.
Mhm.
And then the name will be asked of who is not compliant.
Yes,
Then that will be verified with the nursing division, whoever's doing the case investigations.
that's correct.
And then from that point, if they are in violation, the environmentalist will get with the county officials, the attorney, law enforcement to work on court orders to isolate the people or
Yes.
person. Okay. All
And,
right.
and again, one thing to reiterate, we would prefer that those complaints come through phone call to the health department, not, we don't necessarily investigate every Facebook thing that we see. If that were the case, we'd have to have 100 or 1,000 staff to investigate every complaint on Facebook. So
Okay. All right. Thank you, Stuart. Another question here, and this is for you, Dr. Wayman. There's a lot of people talking about the medicine that's being used in some places to treat COVID-19. I apologize. Is that being used in Kentucky or locally?
I don't know the answer to that. All I can tell you is that on the CDC website, they do mention several treatments, including chloroquine, steroids, and other immunological modulators, because the second part of this disease, which usually hits you in the second week, is what they call a cytokine storm, when the immune system causes so much inflammation that the lungs basically don't work well. And that's when people go on ventilators. So anti-inflammatories are considered. These are all considerations, and I'm sure people are using them as they see fit. Just this morning, I heard good reports about the use of steroids from New York. All of these things are anecdotal. There are not enough studies, and people are not reporting their own experiences in print yet. It's just mostly word of mouth. So I am sure people are using some of these treatments in Kentucky, but I can't tell you who and what and where and exactly what medication.
Hey, Tracy, before you move on, let me answer there's 3 good questions in the YouTube live chat that I think are appropriate to answer. Can I jump in and answer those?
Yes, I have those on my desk, so that would be fun.
I see there's some Zoom chat questions too, but let me grab these YouTube ones. It says, approximately how many tests have been given in Pulaski County? We don't know, because there's a lot of private labs doing the testing now, and private labs and physicians are not required to notify us when a test is administered. They're only required to tell us when a case comes back positive. So we really don't know how many actual tests have been done. It says, could the health department provide a frequently asked question guidance on the use of cloth masks? If you will look on our homepage, the Lake Carmel District Health Department, go down to the news, and on that news post we just posted about how people can volunteer to help us. There's a link there from the CDC about everything you'd want to know about cloth masks. So go there and you'll find your answer. And someone asked, was the 53 positive cases in Pulaski? No, the 53 positive cases as of last night was district-wide. Pulaski has 28 cases as of last night. Of course, we'll update these numbers tonight when everything comes through today. So I'll turn it back to you, Tracy.
Okay, Sean, and there are some questions on Zoom. And this is going to go to you, Stuart, I think, and you probably can see it also. If an employee of a small essential business were to test positive, what is the protocol at that point? And would the entire business be shut down?
It actually would depend, because it depends on how many close contacts they have. So if we have a building full of that they work very close contacts, then it is a possibility that that business could be shut down, because everybody would be exposed to the coronavirus from a potential source. Now, what we can do is we can go back and say, if that person, let's say it'd been 3 days since that person worked there, they became symptomatic 3 days ago, and it'd been 3 days since they worked there, then no, I mean, these people would be able to go ahead and work it. But if they have worked with them while symptomatic, then they are a close contact, and it is a possibility that it could wipe out an entire staff.
Okay, thank you, Stuart.
Stuart, when you say wipe out, you don't mean wipe them out like they all die. You mean they
No,
may
no.
they may be quarantined for a while.
Right.
Statistically-
Not dead wipe out, just they have to go home and stay at home. That kind of wipe out.
Statistically, the mortality rate, what did I say a few minutes ago for our district was? I wrote that down.
3.77.
Yeah, the mortality rate for the state's 5.66, and the mortality rate for Lake Como right now is 3.77. So we don't want to wipe out everybody. Just
Right.
it's getting 3.77% right now.
Yeah.
So.
Okay, so now let's walk around to the counties and see if you all have any specific questions. Adair County, are there any questions from Adair County that you all would like to share? No questions? Okay, Casey County. No questions in Casey. Clinton County. No questions in Clinton. Cumberland County. I don't see anyone there either. Greene County. Macquarie County. Any questions? No. Pulaski County. Russell County. Taylor County. And Wayne. No questions. Okay, I want to ask the panel, is there any final statements you all would like to make to the people joining the meeting today? Stuart, are there any final questions?
I just want to remind everybody that we want to treat it like everyone has the virus. So we need to make sure hands, remain socially distanced from people, only make trips to the store if you need to. When you go to the store, get what you need and get on out of the store. So that we would ask people to do.
Thank you, Stuart.
Yes, if you can't be 6 feet apart, then wear a mask.
Okay. Dr. Wayman, Laura, are there any final comments you want to have for the group? No? Okay, Sean?
I will reiterate what Stuart said. We should, since this is defined as community spread right now, what that means is you should assume that people you're running into when you go out have it. Wearing a face mask does not supersede the need to social distance and to avoid crowds. The face mask option is good, but it doesn't replace that. It doesn't mean if you're wearing a face mask, you can go back to life as normal. You still have to social distance. That's just an extra layer of protection, and it helps you if you absolutely have to for a moment go into someone's 6 feet space bubble. I'd like to say to everyone that's watching live, we had at one point, I think 110 people watching live, plus however many's on our Zoom live. I appreciate you all joining in. I know there's quite a few people that watch these on YouTube too after they're saved out there. And I'll say to you all that might be listening in later, thank you. We have to remember that when someone catches COVID-19, you know, they didn't ask for this to happen to them, and we shouldn't treat them like they've done anything wrong or mistreat them. You know, we'll take precautions to try to keep them safe and to keep the public safe. But you know, when they're out of the risk stage, you know, let's be good to each other. I know when the person that was the contact at the church in Somerset passed away, I was looking at the social media and I just had to stop looking because it was painful for me to see how many people was throwing stones. And you know, for anyone that wants to throw a stone, look at yourself first. Are you really obeying the rules? You know, let's all do our part. Kentucky's doing pretty well statistically compared to the rest of the nation. You know, let's do our part to contribute to that. As we've been saying all along, you know, this disease is going to run its course through our communities. We just don't want it to happen all at once and everyone to get sick all at the same time and overwhelm the hospitals. You know, we need to try to control the spread of it through the social distancing so we can keep our medical operations going and not overwhelmed. So I appreciate everyone who's listened in.
All right, thank you, Sean. I want to encourage everyone to please go to the website, Lake Cumberland District Health Department. There's lots of valuable information on there. We will be back next week at 2:30. I want to also encourage you to send questions in to Melanie Williams at the health department, Melanie Williams at LCDHD.org. And I guess that's all. We will hopefully talk to you all next week. Thank you all.
Bye, guys.